Hello and welcome to the Radio Scilly video news. Sign up to our YouTube channel at youtube.com/Radio Scilly. The Link organisation, the island's health watchdog, that monitors and can criticise or praise healthcare and social service delivery in the islands, say they're pleased at progress at Park House. There are plans to offer dementia care. It is limited, and Clarke from the organisation says things aren't perfect, but they are starting to make a difference with some of their plans. And so far, the Link organisation likes what they're hearing.
It's all about keeping an eye on health and adult social care services. The government does want all service providers to be much more accountable to their public and patients, and the Link is the way for local communities to have their say, make their voice heard. So it's a community organisation run by members, supported by a voluntary organisation which provides the administration, and we work with providers, feeding back what people have to say about their experiences and suggesting ways that they could perhaps be improved.
And I mean, you can suggest, you can advise, but you've actually got some level of teeth as well, haven't you?
We have some level of teeth. If we do ask for information, we have to receive a response within 20 working days. If we make a recommendation or write a report, it has to be considered. We have to have that acknowledged, and they have to show that what they are being told from the public they've taken into account when they're planning their services. They can't just go for targets anymore. They have to say, yes, we've actually looked at this and we've realised that this is where we need to improve, and this is what we've been told, and this is what we're going to do about it.
Well, I guess Nick and Dave have been a bit preoccupied, but I guess you've heard nothing through at this stage about links and the status of links.
No, we haven't. They're putting accountability at the heart of public services still. Dave, of course, is very big on his big society. They would like more voluntary groups like this to be more active, but we're all waiting for the budget on the 22nd of June to see how that translates in actual funding.
You're working on some specific projects as well, or at least you've got some specific areas you want islanders to input into.
Well, absolutely. We've done a survey, which we had quite a lot of responses, and there were a wide range of things that people were concerned about. We asked them about what was working well, but also where things could be improved. So we've picked up on a few of those. Obviously, dementia care was a big one. Now, we can't actually do anything about that, but we're working alongside the council, just watching, just seeing what they're going to do about it and being supportive where we can. We're working with Specsavers about the level of optician care that we receive and how that works from their point of view and how that might be improved. We've done a lot of work with Link in Cornwall about what happens when you're discharged from Trelisk. That's brought up issues about travel warrants. We are going to be working with somebody who's rolling out a whole new patient referral system, so that will bring in outpatient appointments. A lot of complaints about outpatient appointments being given at awkward times of the day, so we're working with people to see if we can change that.
So touching on that, I mean, what's the issue? People have been given appointments at 3 o'clock and they can't get a helicopter back in Windsor.
Absolutely, and what you find is it's a computer-generated system. The doctor refers you to a consultant, the booking clerk puts your name in a computer and out comes an appointment. If it's 9 o'clock on a Monday morning or late in the afternoon, it's going to be very difficult to attend and get back in the same day. Now, we've found, and people generally have found, if you phone up and explain that, they're very good at working with you and trying to find an appointment that will suit you. But what we're going to ask for is for the computer to be told when our postcode goes in, late morning, early afternoon if possible. And if it knows that, then there'll be hopefully fewer appointments being sent out, which are at awkward times. However, we have been told that there is going to be a whole new referral system. So if we can get in on the planning stage of that, then hopefully that will help.
I mean, it shouldn't be a difficult thing to do. It's basic computer programming, that, isn't it? It's databases and stuff.
Absolutely. So we've asked. I'm still waiting for a response, but we're going to keep going with that one. And then a new system of choose and book, where patients can be involved right at the planning stage. They can basically book their own appointment. That's going to be rolled out, and we're going to work with the providers so that we're, as I say, we're in at the planning stage and we can just point out the particular difficulties that we might encounter here.
And is it a real issue with people that...
It's a real grumble. It's a real grumble. And we're here to look at grumbles as much as possibly more serious issues.
Are you getting lots of feedback from people now?
Yes, the survey threw up a lot of interesting responses, and when we did our community events in March, we broadened that and got a lot more ideas. And people are popping in and they are telling us things, and they are using the online form on the website just to tell us about their experiences. Generally it's people saying, I don't want to complain, I don't want to take this any further, but we're seeing a pattern, and if we see a pattern then we can go to the providers and say, right, this is what we've been told, this is happening a lot, let's address it.
About the specific groups you want to put together?
Yes, the Care Quality Commission looks at all services and all National Health Service trusts, the people who run our services, hospitals and paramedic services and X-ray and physio and that sort of thing, all have to be registered with the Care Quality Commission now, and we as Links are invited to report to the Care Quality Commission annually about how those services are performing. Now, we need to know how they're performing in order to do that, so we need eyes and ears. So what I'm asking is that anybody who's already takes an interest, who picks up things that they hear on the radio or items in the news, who might have a lot of experience of a particular service, regular outpatient visits to a hospital or certain forms of treatment, if you think you have a view on how that service performs, then tell us, keep in touch, and then once a year we can get half a dozen people together who are knowledgeable and informed, and we can then write our report and say, yes, this is how people here are experiencing those services, this is how they're performing. So, you know, we can't make things up. We can't just work on our own opinions. We have to show that we've asked and we've been told, and everything that we tell them is evidence-based. So it's people to be eyes and ears, to gather information for us, feedback to us regularly. I mean, we'll call it a work group, and it might be between 4 and 8 people. I'll keep reminding people, give them sort of templates to write little reports now and again, and then once a year we'll get together and draft a report. The other thing is that each National Health Service Trust has to publish what they call a quality account, so they have to account themselves for how well they think their services have performed in a year, and every June they publish that report. We are given an opportunity to read it first and then just say if we think that's fair and accurate or if we have heard differently. So these groups would help with that as well, so that when we get the reports from each trust saying this is how we think we've done, we can say to those people, well, you've used these services, do you think that's fair, do you think that's accurate, or is there anything you'd like to put in? So again, that would be perhaps another little meeting just to draft that report. So very loose work groups, but people who I can keep in touch with regularly and who can report to us regularly, and it will make everything we say a lot more representative.